Hello and welcome to Nikki O's YouTube channel. This is actually the inaugural video for my YouTube channel. Yay me! So I want to thank you for joining, and today we're going to explore the benefits of professional nursing certification. So why certify? Why should you become a certified nurse? Let's look at that. Let's jump right in. So the purpose of this presentation is to explore the benefits of professional nursing certification. So by the end of this presentation, we have three objectives that you should be able to execute. Number one, you should be able to identify at least two benefits of professional nursing certification. Number two, you will be able to identify two professional certifications that are related to your specialty or clinical area. And as you will learn, these certifications are not just random. They were designed to enrich your clinical practice, and as such, they have to be related to the area that you practice in. In fact, even to be eligible to sit for the certification exam, many of the certifications require that you have a minimum of practice hours in that particular specialty first. So you're going to locate or identify the different certifications that will be meaningful to your practice. And number three, our third objective is you will be able to identify a national nursing certifying organization. And hopefully in the upcoming week, you will be curious and you will explore their website. Okay, so a little bit about me. My name, at least for the purpose of this YouTube channel, is Nurse Nikki O. I am a progressive care nurse with a combined 4 years of nursing experience. I began my nursing career at a rural hospital. You know how it is, kind of getting your foot in the door of nursing. I had to go a little bit further out to get that first job. It was a wonderful learning experience there. I was on a med-surg orthopedic unit. It was kind of a hybrid unit, and I learned so much there. I stayed there for about a year, and I wanted to kind of broaden my clinical exposure. And so I relocated to a metropolitan area, and it was there that I got a job on a stroke telemetry unit. And boy, it was certainly a ramp up in terms of the clinical acuity that I saw, and even in some cases the diversity of the patients that I came into contact with. So again, it was a wonderful opportunity to grow and to learn as a nurse. And from that stroke telemetry unit, I transitioned into my current role on a neurological step down unit. So as you see, thankfully it's been an experience of increasingly responsible nursing care, and I've learned at every tier. So it's been great. In addition to my nursing experience, nursing is not my first profession. I have other degrees and I was trained to do other things. Among them, I was a community health educator for a municipality, a municipal health department. So that was a wonderful experience. And I also have been an instructor for an online college, a major online college. So taken together, you can see that I have a passion for teaching. I love to teach, but not only do I love to teach, I love to learn. I am that nerd in the group of my friends. I just love learning. I love learning new things. I love challenging myself intellectually. I'm getting back now into reading a bit more, but it's wonderful to learn. Not only does it edify you personally and professionally, but it can also be good for your unit. You know, iron sharpens iron, and as your colleagues begin to see you do certain things, sometimes they're challenged to do that as well. And finally, one of the things that I want you to know is I wear many hats just like you. I am an individual person with interests. I like to craft. I'm artsy, crafty. I work out. I like cooking and baking, and I have all types of service commitments in my church. I am a wife. I am a mother of three boys, age 13, 9, and 2. So that alone should give you a pretty clear picture of how active my life is. And yet and still, I was able to make a commitment to learn more about certification, identify the certification that I wanted, make a plan, map out a plan to attack and prepare for the certification, study and prepare for it, sit and take it, and pass it. So if I can do that, I just want to encourage you that you too can do that. We can do it together. So now we're going to delve into some of the benefits of professional nursing certification. According to the American Association of Critical Care Nurses, the benefits of certification include competence. Okay, number one is competence. Now, you, in preparing for these certifications, you in many cases will be reviewing material that you're already familiar with. So, as I spoke to earlier, many of the certifications, if not all, require that you have a minimum of practice hours in that field. So much of the material that you will encounter will be a review, a refresher. As well, you're going to augment or broaden your understanding of some of the material that you encounter in preparing for your certification. Many concepts will become clearer to you as you make certain connections, and maybe you understood it at a certain point in a certain light, but that will become so much more transparent to you, and you'll be able to understand it a lot more clearly as you prepare. And finally, you're just going to learn things that you never knew. And this is one of the wonderful benefits of certification. It really does impact your practice, it impacts your knowledge level, and it is just a win-win. I mean, you're definitely going to become more competent just by virtue of expanding your knowledge base. So that is certainly one of the benefits, the wonderful benefits of certification. Number two, certifications help to validate your skills. You know, as I spoke to earlier when I was discussing some of my nursing experience, we come from different types of facilities. One was a rural where I certainly saw different, a certain set of patients. And then when I moved to a more metropolitan area, I saw all kinds of different pathologies. So, you know, what's the standard? What's the standard of practice? Certifications help to validate this is the standard of practice. This, it normalizes and standardizes some of the information, which can even differ from what we learned in nursing school. And of course, you should always, here's my big disclaimer, you always have to abide by your hospital or facility policies and procedures. But certification certainly gives you another layer of standardization in that, okay, when I come into my patient's room and they're actively seizing, what are some of the considerations for me as a nurse? Certification helps to inform that. First, of course, safety is the most important consideration. You need to get that patient into a safe position, ensure airway, etc., etc. So, certification in that way helps to certainly validate your skills. Another wonderful benefit of certification is that in many of the certifications, there's a continuing education component included as a requisite for certification. So to be active, you have to acquire throughout the term of your certification, certain number of hours of continuing education. And you do that by reading journals, by attending conferences, by looking at special webinars and presentations offered by different educational bodies, and in some cases, your certifying body. So, I mean, we're talking about continuously learning and continuously growing. So, that is a wonderful benefit of certification. And number four, studies show that becoming certified increases your confidence and job satisfaction. And we can certainly see a correlation to that, because as you know more, you begin to feel more comfortable in your role. You know, when you first started out as a nurse, you know, there were those months literally of panic in going to work, you know. This wasn't nursing school. These were real live breathing patients, and you could potentially help or hinder in certain situations. And maybe if your preceptor wasn't quite as nice as you would have hoped, you felt intimidated to ask certain questions that could really make a difference. So, I mean, to have the knowledge and to have the confidence, you're going to approach your day and your team a lot more differently. And uh, you're going to feel better. You are going to have a little bit of swagger. Things that maybe even in your doctor's notes that didn't kind of make sense across specialties. Well, why is the nephrologist saying this? And why is the cardiologist saying that? I mean, those connections are going to become a lot more clearer to you, and you're going to be able to understand how some of these comorbidities and copathologies, how they kind of merge together. And it is going to make your job a lot more satisfying, because when you feel more confident about what you know and how you can translate that into better care for patients, ultimately you're going to feel better about what you do. And finally, and you know, this is just, it is what it is. A lot of times it is an advantage to become certified. Studies do show that there is kind of a competitive edge that certified nurse applicants have against a pool of other nurses who may not have that certification. And in some cases, facilities do treasure that. They value that, and they will provide financial incentives, whether it's a bonus, a one-time bonus, or whether it's an hourly compensation. You know, whether you get $1 or $2 more an hour because you're certified in that specialty. That certainly is a win-win. I mean, who doesn't want more recognition, more of a competitive edge, and more money? So it all sounds good to me. Okay, so now we're going to look at professional nursing certifications. And as we see this link, this is actually a link to the Lippincott Nursing Center. As you may well know, Lippincott is one of the premier nursing education information bodies available. So this is a great resource for nurses, and it looks like I'm not able to access the link in the presentation, so I'll be sure to provide that link in the description box. But I will go on to describe some of the organizations for the different certifying bodies. As we start here, I mean, there's such a wide array. I see the Addiction Nursing Certification Board. They provide a Certified Addictions Registered Nurse Certification, the American Academy of Nurse Practitioner Certification Board. Of course, they certify nurse practitioners of FNPs and other certifications that they offer. And then there's my certification body, the American Association of Critical Care Nurses. They provide the CCRN as well as the PCCN certifications. So that certifying body is on there as well. We have the American Association of Diabetes Educators. We have for our cardiac nurses, the American Association of Heart Failure Nurses. The American Board of Managed Care Nurses offer a certification. So again, I mean, certifications for non-clinical professional nurses include case management certifications, education nursing certifications, quality nursing certifications. So all of those are listed in this wonderful site. We see here American Legal Nurse Consultant certifications, okay? You have the American Organization of Nurse Executives, uh, providing their CENP, the Certified in Executive Nursing Practice certification. You have the Certification of Emergency Nursing body, providing the CEN, the Certified Emergency Nurse, the Trauma Certified Registered Nurse, the TCRN designations, among others. You have other bodies, including the HIV/AIDS Nursing Certification Board, the Hospice and Palliative Care Credentialing Center, providing the CHPN, the Certified Hospice and Palliative Nurse Certification. You have infusion nurse certification for all of our sharpshooting IV starters and people that manage our lines, our central lines and ports and things. You can acquire a certification through that body. And again, there are many, many more other ones that we might be used to seeing. Of course, our wound care nurses are certified through the Wound Ostomy and Continence Nursing Certification Board, so they can get their CCCN, Certified Continence Care Nurse, or COCN, the Certified Ostomy Care Nurse, or the CWCN, Certified Wound Care Nurse. So alone in this list, which is actually pretty exhaustive, I've discussed at least 20 or so national certifying bodies along with their respective certifications. And these types of exercises, just getting information and getting out there, we've availed ourselves to different specialties that we may or may not have known were available. So again, in our profession, there are so many different career pathways that one could explore. And so, doing these exercises and information gathering and fact finding, they are so useful because sometimes, as a nurse, you may have the tendency to feel stuck, but you shouldn't, because there's so many different ways that we can merge in our careers that can continue to provide us years of fulfilling service. And so I'm glad that we were able to take a look at this list, and I hope that you visit that list often. Okay, everybody, we are actually winding down. We're coming to the end of this presentation. But in support of our objectives, we are going to identify a certification body and explore the website. I think the objectives talking about you being able to identify at least 2 certification bodies or certifying bodies. But in the prior slide, we've already gone through that long, comprehensive list on Lippincott that lists all the different national certifying bodies. So feel free to browse on your own and go through and look at those certifying bodies that are related to your clinical or specialty practice area, because again, it has to be related to what you actually do. So go ahead and browse on those sites, and the certifying body related to my clinical and specialty area is the American Association of Critical Care Nurses, and this is their website. As you see, they have this is their homepage, and they have a variety of tabs. First up is clinical resources, and who doesn't want those, okay? They have a tab to their conference and events. They have different chapters, and they have different conferences. They're having a huge annual conference in Boston, I think sometime later this year. So there's a link to learn more about that conference. They have a link just for certification for general information. They have a link for nursing excellence, some information and tips in that regard, and there is a link for education. So I am actually a member of the American Association of Critical Care Nurses. So right down here is where I sign in with my email address and password. And being a member, and I was a member before I actually became certified, but being a member, I'm privy to join different conferences. I've gotten invitations through the mail to various conferences sponsored by the local chapters of the AACN. And I mean, that's great. That's great to learn more with your local colleagues and to network. So it's free to sign up. It was free for me to sign up and to become a member of the American Association of Critical Care Nurses. So I appeal to you. Go ahead and look at those different certifying agencies, because in many cases you can sign up and begin to take advantage of the resources that are available. Okay, so this is the AACN's website, and go ahead and learn more about the different certifying bodies related to your clinical and practice areas. So, congratulations. You did it. I mean, we did it. We've made it through this information, this presentation of information on certification, professional nursing certification, and some of the benefits. I just want to say thank you. Thank you for sharing your time and your attention with me. And I certainly hope that the information shared was enlightening to you and that it can be meaningful to you in both your career and your professional practice. But what is an educational activity without a post-test? I mean, hey, how do we measure what we've learned, how we've grown? And of course, we set those learning objectives, those benchmarks at the beginning. So we need to see how we did, how you did, okay? So let's take a little post-test to see what you've learned. So our first question is, 2 benefits of professional nursing certification include. Our first choice is fortune and fame. I don't know if my paycheck would speak to that, so let's keep going and look for some better answers. Competence and bragging rights. C says job satisfaction and demotion. Oh, the horror. And D, increased confidence and validation of skills. So just reset your mind to a few slides earlier when we discussed some of the benefits of professional nursing certification. You, of course, will know that the answer has to be increased confidence and validation of skills. Okay, let's move on to question number 2. Select 2 nursing certifications from the above list that would be appropriate for a medical surg nurse. Remember, we talked about how the certifications have to align with your practice areas. So for a med surg nurse, let's look and see what certifications might be aligned to that specialty. Certified post anesthesia nurse certification, the CPAN. Certified Diabetes Educator, the CDE. Certified Medical Surgical Registered Nurse, the CMSRN. Or the Certified Plastic Surgical Nurse, the CPSN. Remember, we have to select 2 from this list that would be appropriate for a medical surgical nurse. So, A and D, our PACU nurses certainly don't do what med-surg nurses do, and vice versa. Med-surg nurses don't do what PACU nurses do, so that's probably not a viable answer. Certified plastic surgical nurses do not do what medical surgical nurses do in their practice, so again, this is not a viable answer. So we're looking at certified diabetes educators. Certainly medical surgical nurses do interact with diabetic patients. They do a lot of teaching. I certainly did on my floor. You have patients who come in with DKA not even knowing that they're diabetic. So there's a huge teaching component that starts on admission, so that by the time that patient becomes stabilized and discharged, you're teaching the patient about the pathology of diabetes, and you're teaching them about insulin injections, and you're teaching them about sliding scales and things of that nature, or in some cases oral diabetic medications. And so there's a huge component. There's lots of interactions with patients, and there are lots of opportunities to do diabetes education. So this is certainly a viable certification for medical surgical nurses. And of course, the certification that embodies most of what the medical surgical nurses do, the Medical Surgical Registered Nurse certification, the CMSRN. So these are the 2 certifications that would be appropriate for a medical surgical nurse to pursue. So great job. And our last and final question: which of the following is a national nursing certification body? Select all that apply. Oh, I couldn't resist the select all that apply. And just an aside, I'm so glad that I got my past the boards when I did, because I just don't know. I just don't know what these select all that applies. I mean, when I sat for the boards, they were kind of just coming out with this, and we may have had one or two, oh, maybe not that few, but we just had a sparsity of questions. And they were difficult. So I just don't know about these select all that apply, but of course I couldn't resist. So which of these are national nursing certification bodies? Well, if we can recall, or if you need to refer back to the Lippincott site, that wonderful resource there, all of these. All of these are national nursing certification bodies. And I've included the websites here so that you can certainly explore those different certification bodies, because you might be compelled to become a member, and that can be the start of your journey towards certification, professional nursing certification. So very good in that regard. So in conclusion, we have looked at some of the personal and professional benefits to pursuing a professional nursing certification. We have certainly learned more about certifications related to a variety of specialties. And finally, we have looked at certifying bodies that relate to our practice areas, or in my case, my practice area, and we've looked at their website. And I want to encourage you throughout the upcoming week, go ahead to that Lippincott list and start poking around. Start looking at first the certification body, maybe join, become a member, and then zero in on the certification. Things that you want to begin to poke around at are, what is the scope of the exam? How long is the exam? How many questions does the exam entail? How frequently is the exam offered? For some of these exams, it's just an open thing. Some are offered during windows throughout the year. So that's important to know in terms of how you prepare yourself and when you're going to time your timing for sitting for the exam. Also, it's important to know the cost of the exam, because sometimes that can be an important factor. It can either be an obstacle or it can be a non-issue. Thankfully, my hospital had a wonderful program that covered the expense of the exam. I let my supervisor know that I was interested in taking the exam. She referred me to some of the resources for the nursing professionals at our facility, and they have a program where the hospital will sponsor the exam. And we just had to enroll differently, so I didn't go to the AACN website and sign up to take the exam. I enrolled through my facility's program. They took care of everything. I received confirmation that I was registered for the exam, and then there's a window in which you have to test. And we'll talk more about that process later. I can walk you through that whole process of my journey in a later episode. But for now, just begin to start exploring. These are the steps that you're going to take towards getting yourself on the road to certification. Arm yourself with information, and you begin to kind of create a soft goal, create that resolve that, you know what, this is good for me, it's good for my career, it's something that I know I can do if I stick to it and work hard, and I'm going to do it. But these are just the preliminary steps that you're going to take. So it has been a pleasure spending this time with you. Please, this is an evolving channel, and I look forward to sharing my journey with you and to supporting you in your journey towards certification and other things. So please, I encourage you to subscribe to my channel and share it. Share it is necessary. And also, I want you to click, when you subscribe, I want you to click on the bell here in the YouTube platform, so that you can be notified as I upload new videos, because we're going to walk through this whole process together. So please do subscribe, do click the notification box, and do share this YouTube video with other nurses that you think could use the information. Have a great rest of the week, and take care.